The MEGA 2000 pad is a new and innovative approach to solving the hazards of electrosurgery. The Megadyn Corporation researched and produced this technological advancement in return electrodes to improve patient safety and reduce costs. Everyone knows that electrosurgery can only work well if a complete circuit of energy is established. That means the electrosurgery unit sends the RF frequency to the active electrode, which concentrates the energy to a small area. When applied to human tissue, this energy stops bleeding through coagulation and cuts tissue. The weak link in the technology that has led to patient burns is getting the energy safely through and out of the patient's body and returned back to the generator while maintaining low current densities. These old metal plates were dangerous. They would bend, causing hot spots, and required gels to eliminate gaps that could spark and burn the patient. Adhesive pads were a great improvement, and still are, even though they introduced a new series of problems, such as allergic reactions, denuding of the skin, dry contact areas, and problems in application. Site selection has been a major concern with adhesive pads. Hair interferes with conduction, so patients must be shaved prior to pad application. Bony prominences, metal implants, scars, and fat tissue must be avoided because of the possibility of promoting burns. If traditional monitoring pads are applied incorrectly or pull away from the patient, the energy flow is stopped. If this occurs with non-monitoring pads, the current can be concentrated at the pad site, which can cause a burn. If ground reference generators are used, the current may be redirected to an unintended area, also resulting in burns. Disposable adhesive pads are also unfriendly to the environment, taking years to disappear from landfills or causing toxins when incinerated. The MEGA 2000 pad solves many of the adversities experienced with the adhesive grounding pads. First, and most important, remember that a complete circuit is needed. The return electrode pad must be in contact with the patient, and it must be large enough to keep the current density low. The MEGA 2000 pad is designed to safely exit current from the patient by minimizing the concentration of current. This is accomplished through the principle of capacitance, the charging of two electrical conductors separated by insulation. One conductor is the metal within the return pad. On this pad, the insulation is the polyurethane covering, plastic sheath, and the linen sheet on the OR bed. On a standard pad, the insulator is the gel, which separates the patient and the metal. The patient is the other conductor. As you can see by the arcing, this non-monitoring dispersive pad can cause patient burns due to the minimal amount of resistance gel provides and the small size of the pad. No arcing occurs with the MEGA 2000 reusable pad because the insulation is much greater between the patient and the metal of the pad. The protection provided is a combination of the large pad size and the volume of insulation between the patient and the conductive metal plate. No arcing means no burns. The MEGA 2000 pad is the guardian of electrosurgical patient safety. First, make sure the pad is intact. Check for cracks, tears, holes, peeling, and delamination. If any are found, replace the pad. Next, apply the outer sheath. This adds an additional layer of insulation and, along with the pad, can be cleaned for reuse. Then, check the conduction cable connection. It is riveted onto the conductive mesh and has a strain-relieved design to prevent inadvertent disconnection. Position the pad on the OR bed relative to how the patient will be positioned. The size of the pad is large enough to extend to at least half the length and full width of an adult patient's torso. For procedures in the sitting or lithotomy position, place the pad high enough to avoid problems at the break of the table. For prone positions on bolsters or bean bags, place the pad over the positioning devices. Put the sheet on next. The patient's skin does not have to be in direct contact with the sheath or pad. If monopolar and bipolar energy are used during the same procedure, the pad will work fine, causing no problems with the bipolar energy. If two monopolar generators are needed, use one Mega 2000 pad and one standard pad, each connected to their respective units. If fluid pools under your patient, safety is still provided as long as the pad is covered by this sheath and has no holes or lacerations in it. It is always best to minimize the pooling of fluids. Replace the sheath if it has become contaminated with blood or bodily fluids. The sheath and pad should be cleaned after each patient use. The following disinfectants can be used: Cidex, Hibiclens, Vesfine, Wexide, and Quat 5, along with other recommended disinfectants. Do not use alcohol. After cleaning, make sure to dry the pad and the sheath before the next use. The Mega 2000 return pad is a bold departure from the conventional means currently used in electrosurgery. Because it's reusable, it's more cost-effective and environmentally friendly. But patient safety and comfort were truly the driving forces behind this innovative product. No adhesive means no skin trauma, no allergic reaction, and more comfort for the patient since they don't have to endure shaving. The potential for pad site burns is eliminated by lowering current densities to a safe level. Bony prominences, metal implants, hair, scar, or fat tissue are no longer obstacles to safe electrosurgery. It's these qualities that make the Mega 2000 return pad the guardian of electrosurgical patient safety.